We're very honored to welcome you at our GPON conference, and you represent Maggie's Foundation. My name is Mina Doumit. I'm a GPON member. GPON stands for Global Power of Oncology Nursing, and I'm from Lebanon, which is considered a low to middle income country. And the GPON mission is to provide a global forum for the recognition of the specialty of oncology nursing to bridge the gap disparities between nurses working in high income countries and nurses working in low and middle income countries. And the purpose is to provide experiences, challenges, research experience to nurses working in low middle income countries. And again, we're very honored to receive you today and for you to brief us about Maggie's Foundation. What do you do? How do you work? So please, can you introduce yourself to our audience and just tell us about your foundation?
Yes, thank you, Marna. So my name is Andy Anderson. My background is as an oncology nurse. So I qualified as a registered general nurse in Edinburgh in Scotland in 1990, and then worked in the oncology unit at the Western General Hospital in Edinburgh for 12, 13 years, specialising in different areas of oncology care, in inpatient chemotherapy, radiotherapy, specialist bone marrow stem cell transplant, and then in clinical trials. And then I made the move to Maggie Centre, which opened in 1996 in Edinburgh, which was a very new, innovative charity set up by a woman called Maggie Keswick-Jinks, a really remarkable woman, somebody who had her own breast cancer diagnosis, who in the middle of her very excellent medical and nursing care and treatment recognised that her emotional, psychological, social, family needs weren't fully able to be met by the hospital. So she set up an organisation to look at providing that support to people affected by cancer similarly to her. And 27 years later, we now have 24 centres across the UK, 4 centres internationally. And my role has been as a cancer support specialist within the organisation, a centre head within the organisation, and now involved in induction and development not only across the UK, but also across the globe.
While looking and surfing your website, I've noticed that you don't only work with patients or family, but also you try to empower oncology nurses. So what do you exactly do as a nurse for oncology nurses? And how can we transfer this experience to low and middle income countries?
Organisationally, we take time to invest in each other as healthcare professionals. So supervision, staff support, training, development has been integral to the organisation's foundation from day one. We have weekly staff supervision to make sure that the emotional burden of providing support to people affected by cancer is manageable for us as clinicians working in the organisation. And that's probably one of the key things that we've been able to look at in terms of supporting our hospital colleagues. Our keenness is to make sure that Maggie's can be a resource to hospital clinicians as well as to people affected by cancer. So over the years, there's many individual examples of hospital colleagues for whom they've either had a personal experience of cancer, a family experience of cancer, or that they felt somewhat burnt out by the intensity of the complex work that they're doing in hospitals. And we've been able to provide one-to-one support for them, peer support and peer supervision, relaxation and stress management intervention, or importantly also training in communication skills and providing structured support to people affected by cancer. So one of the crucial things of Maggie is partly helping to support our brilliant hospital colleagues to grow the skills that they already have, to feel more confident in the skills that they have, but also to help put a structure around that to help them feel able to sustain the brilliant complex work that they do.
Wow, that's excellent, really excellent. Andrew, you mentioned that you have several centers across the UK and you have centers outside the UK. How can you make sure that this spirit, this culture prevails in all your centers?
The essence of Maggie's is very simple, but also extremely complex. You know, the simplicity is staffing brilliantly built centres with high qualified healthcare professionals to provide advice and guidance to people affected by cancer. But it is important that it's done in a unique way. It's done in a way that is focused on the human being, either as an individual, as a couple, or as a family. It's focused on their needs rather than the needs of us as an organisation. And the biggest skill of the organisation is giving the time to listen. So listening to the individual's needs. And our training program for new staff is really robust. People have an induction process where they have a 2-week immersion process in their induction, and then an extended 6-month induction process with a range of resources available, both written, video, and also face-to-face learning with their line manager and their peers and colleagues. I was a good healthcare professional within the hospital. I think I'm a better healthcare professional at Maggie's because I've been able to be free of a lot of the structures that the hospital's systems have to have. But what that allows me to do in Maggie's is to be much more focused on the individual and the people around them. So you're right, the quality benchmark of Maggie's is extremely precious. And my role and a number of key colleagues associated with me are there to look at training, development, supervision, and provision of guidance for new centre development to make sure that that essence is held very precious. There is a risk with growth. You dilute the brilliance. What I'm really proud to be able to say is that with growth, we've enhanced the brilliance, because our centres across the UK are centres in different parts in the UK with different socioeconomic needs, different cultural needs, different needs in terms of geography. So we've learned each time we've opened a new centre, and those new centres help to inform our existing centres. But we've also learned hugely from our international partners. So we've worked with teams in Hong Kong, Tokyo, Barcelona, and the Netherlands so far. And the learning that we have as a shared experience is enormous, because they are working with different cultures and different approaches and different languages around cancer, which helps to inform the UK.
Can we ever dream that in low middle income countries we would have something similar to Maggie's, support our oncology nurses, our patient family? And what can we do? And what can you say to our audience who are listening to us now about installing or creating a Maggie's center, if you want to say, at the same time respecting the culture?
Absolutely. So yes is the answer. It is important to be able to dream, and it's important to be able to not just dream but demand it, because people affected by cancer require this extra level of support. And also importantly, healthcare professionals in cancer care require that level of supervision and support to be able to sustain the brilliant work that they're doing. So it is important to demand it. We're very fortunate within the UK that we were able to set up a structure of a charitable organisation to be able to provide this service. And I appreciate that in lots of countries that isn't as familiar a structure. And also, sadly, it does take money to be able to start building buildings, to be able to provide the support that we offer in the way that we do. However, there are good examples of countries where we've worked closely with and given guidance and advice to, where they haven't had to build expensive buildings and they haven't had to put a huge amount of infrastructure in, but they have changed the way in which they care for each other as clinicians and colleagues, and they have changed the way in which they're able to look at social services and psychological services for people affected by cancer. It may be that that has to be done in a very financially astute way, so lots of group activity, lots of multi-purpose activity. But if you start a process and describe that you know it as an essential for your client group and also for your own professional grouping, then you can start something happening and you can make it happen.
Thank you, Andrew, very much for this presentation. And if I want to conclude in one sentence, when there is a will, there is a way. Not necessarily if we don't have the means to have big buildings, sophisticated buildings, but it is set of mindset, how to deal with each other, how to support each other, and how to support our patient. And of course, I'm volunteering on behalf of you and Maggie's that if any of our colleagues in low middle income countries hearing us, seeing us today would like to have any consultation, any help, you're always available, right?
Absolutely. Yeah, I totally agree with you. This is a mindset shift, and it's a mindset of can do and a mindset of knowing that you want to provide the best quality, not only to the people you're supporting, but to yourself and to your colleagues.